Now that we have discussed the census questions and data collection issues, in this episode, we will cover tabulations needed to estimate pregnancy-related and maternal mortality from census data. Here are the list of required tables to estimate pregnancy-related or maternal mortality. Now let's take a look at each one of these. The first table you need is a table with the population by age group and sex. We will use these as denominators. In the first column, we have the age groups. In the second column, we have the counts of males for each age group, then the counts of females in the third column, and the total population in each age group in the fourth column. You may want to do a simple consistency check by adding the males and females for each age group and check against the total for the age group. Similarly, sum the male column and check against the total male population. Sum the female column and check against the female population. Then add the total male and total female together and check against the total population. The next table you will need is the total number of deaths by age group and sex. These will come from the household death questions asked about death in the household in the 12 months before the census. Next, we will need the number of pregnancy-related deaths in the last 12 months before the census by age group. These will come from the responses to the household death questions where the deceased is a woman between the ages of 15 to 49. Any deceased woman who died either while pregnant, giving birth, or within 6 weeks of the end of pregnancy or childbirth would be counted as a pregnancy-related death. A tabulation may look like this. What we need for our estimation is the number of pregnancy-related deaths by age, which we will use in the Census PRM workbook to calculate the pregnancy-related mortality ratio. For maternal mortality, we need the number of maternal deaths in the last 12 months before the census by age group. If you recall from Module 1, the definition of maternal mortality excludes death due to incidental or accidental causes from pregnancy-related mortality. A tabulation for maternal deaths might look like this. This is a three-way cross tabulation. As with pregnancy-related deaths, we have the age group in the first column. This time, we only include those who were pregnant, giving birth, or within 6 weeks of the end of pregnancy or childbirth at the time of death, and did not die of accidental or incidental causes of death. The cases to exclude are grayed out in the table below. The cases to include are in white. Alternatively, if you are using a program like CS Pro to produce a tabulation, you can filter out all cases of accidental or incidental death from your universe and then run the same tabulation as pregnancy-related deaths. For the number of live births, you can use responses from the question on the date of birth of last child born alive. Tabulate only the birth with the date of last child born alive within 12 months of the census date. We also need a tabulation of the number of children ever born by age of mother. Use responses from the questions on children ever born by sons and daughters to tabulate the total children ever born. If the census also asked questions about the children surviving and children died, it is a good idea to do a quick check to make sure that the totals add up. This episode covered the tabulations required for estimating pregnancy-related and maternal mortality from census data. These tabulations will be used in Module 5 when we show you the Excel workbook used to calculate pregnancy-related and maternal mortality indicators. If producing subnational estimates, these tables should be done for each area that you are producing estimates for. These may be by rural-urban areas, regions, or by education levels. Now we're ready to evaluate the mortality and fertility data, which we will do in Module 3.